Hi, I'm Kat Taylor,
Hi, I'm Jen DiFatta.
and we're both students at Carroll Community College in their Physical Therapist Assistant program.
Today in this video, we will be explaining and demonstrating the gait dysfunction known as the positive Trendelenberg sign or Gluteus Medius Gait.
A positive Trendelenberg sign occurs when the abductor muscles, mainly gluteus medius but also gluteus minimus, are weak and the body cannot maintain its center of gravity on the side of the stance limb.
The gluteus medius is very important in the stance phase of the gait cycle in order to keep both hips level with each other. We identify the weakness during the stance phase when one side of the pelvis drops. The opposite side of the pelvic drop is the involved side.
So there's two different ways that you'll notice it. So it'll be when the patient is not compensating, so it's uncompensated, and it'll be during single limb support, the pelvis drops to the opposite side of the weak hip abductors. But when the patient is compensating, during single limb support, the trunk and the pelvis will lean to the side of the weak hip abductors. The patient's compensating with this movement in order to shift their center of gravity closer to the axis rotation of the stanced hip.
If the patient has weakness in bilateral gluteus medius, they'll actually waddle walk as the pelvic drops on both sides.
When raising one leg laterally or when walking, the abductors are working on both sides of the hip. The abductors contract concentrically to create lateral movement on the side of the moving leg, but at the same time, the abductors on the supporting side are contracting eccentrically and pulling the other side of the pelvis laterally to maintain it in neutral. This is to offset the weight of the unsupported right leg.
We're going to demonstrate these walks for you now.
All right.
If the left gluteus medius is weak, two things will happen. In an uncompensated gait, the right side of the pelvis drops when the right leg leaves the ground and begins the swing phase. In a compensated walk, the body leans over the left leg during that leg's stance phase. This then occurs with a shifting of the trunk over the affected side. This is an attempt to reduce the amount of strength required by the hip abductors to stabilize the pelvis. When there is bilateral weakness, both hips will drop as the patient attempts to walk. Gluteus medius gait can occur with anterolateral total hip replacement due to avulsion of the abductor tendon. Also could occur with nerve damage and dysfunction of the superior gluteal nerve, disease processes like poliomyelitis and muscular dystrophy. There are a few exercises that can be utilized for increasing your strength. The main ones here are side step ups or single leg stands. You can also abduct the leg outwards to increase the muscle strength of the abductor. Thank you for watching our video about gluteus medius gait. Have a great day.
Bye.